218. In a House of 435 members, it is the only number that truly matters, and yet it is one that a speaker usually keeps under lock and key. But yesterday, Monday, March 30th, Speaker Mike Johnson, Republican from Louisiana, lost the combination.
It's a rare moment of procedural defiance. We're talking about a discharge petition, basically the legislative equivalent of a mutiny. For weeks, we've been tracking the fallout from the DHS shutdown and the standoff over humanitarian protections for over 300,000 people. Yesterday, the rank and file decided they'd had enough of the waiting.
The transcript from the floor captures the tension perfectly. Democrat from Massachusetts Jim McGovern stood at the podium to announce the milestone, and his words really land when you read them in the record. He said, and I'm quoting here, "When the leadership refuses to lead, the House must act. This is not about partisan gamesmanship. It is about 300,000 human beings waiting for a lifeline while this chamber sits in a manufactured silence."
And it wasn't just a one-sided push. To hit that 218 mark, you need crossover. We saw several Republicans, including Mike Lawler from New York and Brian Fitzpatrick from Pennsylvania, add their names to the list. It's a fascinating breakdown of the Speaker's leverage. Since we have a bit more room to breathe today, I want to really dig into the how of this, because getting 218 people to agree on a procedural coup is significantly harder than getting them to agree on a bill.
It really is. We're going to look at the specific protections this move triggers, the frantic whip counts that happened behind the scenes yesterday, and what this means for the broader 40-day stalemate that has paralyzed the Capitol.
It's the first real crack in the stone wall we've seen all month. Let's start with how they actually reached the threshold.
The magic number, 218. If you look at the House Clerk's website or the final pages of yesterday's Congressional Record, you'll see a list of names that represents one of the rarest sights in a divided Congress. It's a list of 218 members. Not 217, not 219, exactly 218. That is the magic number required for a discharge petition to succeed. And yesterday, Monday, Representative Ayanna Pressley, a Democrat from Massachusetts, officially triggered the mechanism to force a vote on humanitarian protections for Haitian nationals.
It's a procedural maneuver that essentially functions as a legislative emergency brake. For listeners who don't spend their days reading House Rule 15, the discharge petition is how the rank-and-file members tell the Speaker, "We are taking the steering wheel now." It's incredibly difficult to pull off because it requires members of the majority party to openly defy their own leadership's control over the floor calendar. In this case, we saw a group of Republicans decide that the situation in Haiti was urgent enough to risk the wrath of the Speaker's office.
The record shows the formal motion was filed regarding House Resolution 965. This resolution is the vehicle to bring the actual bill, House Bill 1689, to the floor. That bill would require the Secretary of Homeland Security to designate Haiti for Temporary Protected Status, or TPS. This isn't just a minor administrative tweak. It provides deportation stays and work permits for an estimated 350,000 people. Representative Pressley's motion in the record reads, "Pursuant to Clause 2 of Rule XV, I, Ayanna Pressley, move to discharge the Committee on Rules from the consideration of the resolution, H-Res 965.
What stands out to me in that list of 218 signatures isn't the first name, but the names buried in the middle. We see Representative Maria Elvira Salazar, a Republican from Florida, and Representative Brian Fitzpatrick, a Republican from Pennsylvania. Those are the defectors, or the bipartisan partners, depending on who you ask, who made this possible. Without those handful of Republicans, this petition would have just been another symbolic gesture by the minority party that ended up in a filing cabinet.
Representative Salazar's involvement is particularly interesting from a geographic perspective. Her district in Miami has a massive Haitian American constituency. For her, this isn't an abstract debate about border policy. It's about thousands of her own constituents who are currently living in a state of legal limbo. The record shows this bill has been sitting in the Rules Committee since December 18, 2025. For over 3 months, it was essentially bottled up. By signing this petition, Salazar and her colleagues are saying that the committee process is no longer a viable path.
And that highlights the internal pressure within the Republican Party. You have the leadership, like Speaker Mike Johnson, a Republican from Louisiana, who generally wants to keep immigration-related votes focused on enforcement and border security. Then you have members like Representative Don Bacon, a Republican from Nebraska, and Representative Mike Lawler, a Republican from New York, who also signed this petition. They represent districts where a more moderate, humanitarian-focused approach to specific crises, like the one in Haiti, carries a lot of weight. They are threading a very thin needle here.
Most people don't realize how physical this process is. To sign a discharge petition, a member actually has to walk down to the well of the House and sign a document kept at the clerk's desk. It's a very public act of defiance. You can't do it quietly or via proxy. When you see names like Representative Mark Molinaro, a Republican from New York, appearing on that list alongside Representative Alexandria Ocasio-Cortez, a Democrat from New York, it shows how the crisis in Haiti has created an alignment that you almost never see on the House floor.
There's a tension here, though. While this is a win for the pro-TPS coalition, it's a direct challenge to the authority of the Rules Committee. If every group of 218 members started doing this, the Speaker's power to manage the floor would evaporate. That's why you'll often hear leadership staffers refer to discharge petitions as a nuclear option. It breaks the fundamental deal of the House, which is that the majority party decides what gets voted on. By reaching 218, these members have effectively formed a temporary coalition government for the sole purpose of this one issue.
The context of the Haiti crisis is what drove this. The country has been dealing with an escalation of gang violence and political instability that has made deportations a logistical and moral nightmare for many of these members. Representative Yvette Clarke, a Democrat from New York, who has been a lead advocate on this for years, has argued in the past that sending people back to Port-au-Prince right now is essentially a death sentence. That argument seems to have finally resonated with enough Republicans to cross the threshold.
Wait, let's look at the timing. The petition reached 218 signatures late Friday, but it was formally entered into the record yesterday, Monday. Under House rules, once the petition reaches that 218 mark and is reported, there's a mandatory waiting period. It has to sit on the discharge calendar for 7 legislative days before a member can actually call it up for a vote. So, we aren't going to see a vote this afternoon. This is a slow-motion takeover of the House floor.
Exactly. And the Speaker has a few moves he can make in the meantime. He could try to preempt the petition by bringing a different version of the bill to the floor under a standard rule, which would allow leadership to maintain some control over the amendments and the debate time. But the fact that the petition reached 218 means his leverage is almost gone. The signatories include Representative Marie Gluesenkamp Perez, a Democrat from Washington, who was the 218th name to go on. Once her pen hit the paper, the clock started ticking.
I'm curious about the Problem Solvers Caucus influence here. Representative Brian Fitzpatrick, who we mentioned, is a co-chair of that group. They often talk about wanting to bypass gridlock, but they rarely actually use the discharge petition to do it. Seeing him and other members like Representative Josh Gottheimer, a Democrat from New Jersey, on this list suggests that the middle of the aisle is starting to flex its muscles in a way we haven't seen in the 119th Congress yet.
It's worth looking at the specific language of House Bill 1689 that this petition is forcing. It doesn't just ask for a designation, it mandates it. It says the Secretary of Homeland Security shall designate Haiti for TPS. Usually, that's a discretionary power held by the executive branch. By passing this, Congress would be taking that discretion away and forcing the administration's hand. It's a significant assertion of legislative power over the Department of Homeland Security.
Which is an interesting twist, because the current administration has been supportive of Haiti TPS in the past. But they've been cautious about the scale of new designations amid the broader immigration debate. This bill would give the administration the cover of a congressional mandate. They could say, "We didn't just choose to do this, Congress forced us to." That might actually be a relief for some officials at DHS who want to provide the protection but are worried about the political optics of doing it unilaterally.
Let's talk about the 350,000 figure. That is a massive number of people who will suddenly have legal work authorization. In the record, the proponents argue this will actually help the U.S. economy by filling labor gaps, while opponents who haven't signed the petition argue that any expansion of TPS acts as a pull factor for more migration. The debate on the floor, once it finally happens in a week or so, is going to be a microcosm of the entire national argument over immigration.
And it's a debate that the Republican leadership was clearly hoping to avoid. Every day spent debating Haiti TPS is a day they aren't talking about their preferred topics, like government spending or oversight of the Department of Justice. By forcing this onto the calendar, the 218 signatories are effectively setting the agenda for the next 2 weeks. It's a reminder that in the House, the majority rules, but the majority doesn't always mean the party in charge. It means any group that can get to 218.
The fallout from this is already starting to ripple through the committees. I was looking at the list of signatories again, and I noticed that several of them are members of the House Homeland Security Committee. When you have members of the Committee of Jurisdiction signing a discharge petition to bypass their own chair, it indicates a total breakdown in the internal negotiation process. Representative Mark Green, a Republican from Tennessee and chair of that committee, is notably not on this list, and he has been very vocal about the need for stricter immigration controls.
It's a direct rebuke of his leadership on that issue. But you also have to look at the Senate side. Even if this passes the House because of this discharge petition, it still has to get through the Senate. Senator Chris Van Hollen, a Democrat from Maryland, has been pushing for a similar measure. The success of the House petition yesterday, Monday, puts immense pressure on the Senate to act. They can no longer say, well, the House will never pass it, so why bother?
That's a great point. The House won't act excuse is the favorite shield of the Senate. If this bill passes the House with a bipartisan majority, which the petition suggests it will, then the Senate is the only thing standing between these 350,000 people and their work permits. It changes the entire narrative of the spring legislative session.
We should also note that this isn't the only discharge petition circulating. There are several others regarding Social Security and tax policy, but the Haiti one is the only one that has reached the threshold. It's a very specific set of circumstances, a humanitarian crisis, a large and vocal diaspora in the U.S., and a small group of swing district Republicans who are willing to jump ship.
And it brings us back to that central theme we see so often in the record. The rules of the House are designed to give the Speaker near total power, but there are these tiny, narrow escape hatches built into the manual. Yesterday, for the first time in this session, the House actually used one. It's a significant moment for the 119th Congress, and it sets the stage for a very high-stakes floor fight in the second week of April.
It's going to be fascinating to see how the Speaker responds when that 7-day clock runs out. Will he let the vote happen, or will he try to move the goalposts? The record from Monday tells us the members have done their part. Now we wait to see if the institution can handle the result.
While that clock is ticking on the 350,000 people waiting for TPS, there is another humanitarian crisis that the House spent a significant amount of time discussing yesterday, though this one hasn't reached the 218 signature threshold yet. We need to shift our focus to the escalating situation in the Caribbean more broadly. The logistical side of the Department of Veterans Affairs often feels like a time capsule. If you look at the committee reports filed yesterday, Monday, March 30th, there is a very clear push to finally move VA scheduling out of the era of the thermal paper fax machine. Representative Mike Bost, a Republican from Illinois and chair of the House Veterans Affairs Committee, formally reported H.R. 3482. It has a long title, the Veterans Community Care Scheduling Improvement Act. But the goal is incredibly specific. It mandates the creation of a centralized online portal to handle appointments for veterans who are seeing doctors outside the VA system.
It is one of those situations where the technology seems like it should have existed a decade ago. Right now, if a veteran is eligible for community care, meaning the VA can't see them quickly enough, or they live too far from a facility, the process to actually get that appointment booked is surprisingly manual. We are talking about VA staff literally picking up the phone, calling a private doctor's office, and hoping someone picks up. Then they have to coordinate schedules, fax over the medical authorization, and wait for a confirmation. If that sounds like trying to book a hotel room in 1985, that's because the workflow isn't much more advanced than that.
The record shows exactly how the committee intends to bridge that gap. The report states, and I'll quote directly here, "This bill mandates the creation of an online portal that would allow VA employees to facilitate these appointments under the existing Veterans Community Care Program." The idea is to give a VA scheduler the same kind of real-time visibility that you or I might have when using a third-party booking app for a dentist appointment. Instead of the back-and-forth phone tag, they can see the availability of a private provider in the community and lock it in right then and there.
Which sounds simple until you realize the scale of the network we are talking about. Thousands of private clinics, thousands of VA employees, and millions of veterans. What stands out to me in the text of H.R. 3482 is the one-year deadline. The VA has exactly 12 months from the date of enactment to get this portal functional. In federal IT terms, a year is a sprint. Usually, these kinds of digital overhauls get scheduled over 5 or 10 years, which is often why they are obsolete by the time they launch.
That tight timeline probably explains why the Congressional Budget Office estimate is so low. They are projecting the implementation will cost about $3 million over the next decade. For a government software project, that is essentially pocket change. It suggests that the committee doesn't expect the VA to build this from scratch. They are looking for the agency to leverage existing commercial technology or integrate with the systems private healthcare networks are already using.
The bill underwent some significant refinement before it hit the floor, too. Representative Nikki Budzinski, a Democrat from Illinois, offered an amendment during the committee markup that actually struck and replaced much of the original text. Her version was designed to ensure that the electronic process didn't just become another layer of bureaucracy. She wanted to make sure the portal actually talked to the existing VA health record systems. If the portal is a standalone island, it doesn't help the veteran because their records won't follow them to the private doctor.
That's the administrative loop we hear so much about. A veteran gets the appointment, shows up at the private specialist, and the specialist says, "I don't have your charts." Then the veteran has to call the VA. The VA has to find the file, and suddenly the day is wasted. The Budzinski Amendment prioritizes that data flow. It also mandates specific training for the staff. The legislation recognizes that you can't just drop a new piece of software on a desk and expect it to fix systemic delays. You have to train the people who are currently habituated to the manual phone and fax method.
I'm curious about the outreach component of this bill. It requires the VA to actively recruit community providers to use this portal. Do we know if there is any incentive for a private doctor to sign up? If I'm a busy cardiologist in a private practice, why do I want to learn a new VA software portal just to manage a few veteran patients? The bill seems to bank on the idea that making it easier for the provider to get paid and get records will be the selling point. If the administrative burden on the doctor's office goes down, they are more likely to accept more veterans.
The American Legion has been vocal about this specific point. They've argued that the current friction is a primary reason why some private doctors drop out of the VA network. It's too much of a headache for their billing departments. If this portal streamlines the authorization process, it effectively acts as a retention tool for the VA's community partners. Beyond the training, the bill also includes a public-facing component, a website where veterans can see the details of the program and eventually track the status of their own scheduling requests.
And the accountability measures are quite rigid. The VA has to submit regular reports to Congress on performance metrics. They have to track wait times specifically for these community care appointments compared to internal VA care. There is often this tension in the building between those who want to push everything back into the VA's direct care system and those who want to expand private options. This bill tries to sidestep that debate by focusing entirely on the efficiency of the choice that already exists.
It is a practical approach. If the law says a veteran is entitled to community care under certain conditions, then the government has a duty to make that care accessible. Yesterday's report by Mr. Bost shows a rare bit of consensus. The bill was reported out of committee with broad support. It didn't get bogged down in the larger ideological battles over the privatization of the VA, mostly because it addresses a universal grievance, the sheer frustration of waiting for a phone call that never comes.
One detail that people might miss is the 7-year evaluation period. The system is mandated to operate for 7 years, at which point the VA has to provide a comprehensive analysis of whether it actually worked. Did it reduce wait times? Did it save money? Did the staff actually use it? It's a built-in prove it clause. If the portal turns into a billion-dollar boondoggle that no one uses, the data will be right there in the report for the next generation of lawmakers to see.
It also addresses a specific gap in how the VA manages its internal versus external scheduling. Right now, a VA scheduler might have a great interface from booking an appointment within the VA hospital, but the moment they need to step outside that wall, they're basically starting from zero. This legislation forces those two worlds to share the same digital landscape. The hope is that the scheduler treats a community care appointment with the same ease as an internal one.
It's interesting how much weight the committee is putting on guidelines. The bill doesn't just say build a portal. It says the secretary must establish clear guidelines for how it's used. That sounds like a way to prevent the VA from using the portal as a gatekeeping mechanism, making sure that if a veteran is eligible for outside care, the technology facilitates it rather than being used to steer them back toward longer wait times inside the VA.
Wait times are the third rail of VA politics. If you look at the 119th Congress, there is a heightened sensitivity to any administrative delay. By focusing on the plumbing, the literal digital connections between the VA and the private sector, lawmakers are trying to fix the problem without reopening the broader, more contentious debates about the Mission Act or the future of the VA. It's an exercise in modernization as a solution to policy gridlock.
And the cost is the real kicker. $3 million over 10 years is essentially saying the VA already has the infrastructure. They just haven't connected the dots. If it works, it would be one of the highest returns on investment for a piece of veterans legislation in years. But as we've seen with other VA tech projects, the if it works is a very large hurdle. The history of federal IT is littered with $3 million ideas that turned into $300 million problems.
The committee report from yesterday is the first step toward finding out which way this one goes. It's now headed to the committee of the whole House, which means we should see a full floor vote sooner rather than later. For the millions of veterans who are currently stuck in that phone tag loop, the prospect of a functional portal is more than just a convenience. It's the difference between getting a scan next week or waiting 2 months for a scheduler to finally fax a form.
It really highlights the shift in focus we're seeing. Instead of debating the merits of the program itself, the conversation has moved to the quality of the delivery. The administrative loop isn't just an annoyance. It's a barrier to the care that Congress already authorized. Moving toward a more private sector-style booking system is the kind of common-sense update that usually gathers this kind of bipartisan steam.
Exactly. It's about closing the gap between what the law promises and what the veteran actually experiences in the waiting room.
But as we move from the digital fixes of the VA to the broader economic picture, we see that efficiency often comes with its own set of hidden costs.
When we talk about government spending, the numbers usually have so many zeros that the human brain just stops processing them after a while. But yesterday, Monday, the House Committee on Veterans Affairs filed a report for H.R. 3482. And the price tag attached to it by the Congressional Budget Office is almost jarringly small. We are looking at $3 million over the next decade. In the context of the federal budget, that is essentially the rounding error on a rounding error.
It's definitely a change of pace from the billion-dollar appropriations we usually see. But that $3 million is targeting one of the most persistent friction points in the entire Department of Veterans Affairs ecosystem. We're talking about the Veterans Community Care Program. If you aren't familiar, this is the system that allows veterans to see private, non-VA doctors if the wait times at their local VA facility are too long, or if they live too far away from one. It sounds seamless in theory, but the actual process of getting that appointment scheduled has remained stuck in a sort of technological purgatory.
The transcript from the committee report clarifies the fix. The bill, which is the Veterans Community Care Scheduling Improvement Act, requires the VA to set up a specific online portal. As the record states, this bill mandates the creation of an online portal that would allow VA employees to facilitate these appointments under the existing Veterans Community Care Program. Right now, the system is surprisingly manual. If a veteran qualifies for community care, a VA staffer often has to pick up a phone, call a private doctor's office, wait on hold, and trade faxes back and forth to confirm the appointment. It is a very 1990s solution to a 2026 problem.
That manual nature is exactly why the American Legion has been so vocal about this. They have been pushing for this specific update because their members are telling them that the choice offered by the Mission Act, which established this program, is often an empty promise if the administrative hurdle to actually book the doctor is too high. If you have a veteran with a chronic condition who needs a specialist, and the VA scheduler is playing phone tag with a private clinic for 3 weeks, that veteran is just sitting in limbo. The American Legion's argument is that efficiency here isn't a luxury. It's a core component of the care itself.
It's interesting to look at who is steering this through the House. Representative Mike Bost, a Republican from Illinois and the chairman of the Veterans Affairs Committee, is the one who formally delivered the report to the clerk yesterday. But it hasn't been a purely partisan effort. During the markup, Representative Nikki Bensinski, a Democrat from Illinois, offered a significant amendment that actually streamlined the language of the bill to ensure the portal would integrate properly with existing VA health records. It's one of those rare moments where both sides seem to agree that the plumbing of the system is broken and needs a wrench, not a debate.
Why do you think the cost is so low, though? $3 million over 10 years suggests they aren't building a brand new, ground-up software architecture. If they were trying to invent a new system, we'd be looking at hundreds of millions. Is the plan to just build a front-end interface for what they already have?
That's exactly what the CBO analysis suggests. The estimate covers the IT development for a portal that bridges existing databases. The VA already has the data on the veterans and the list of approved community providers. The work here is creating a secure, centralized way for a VA scheduler to see a private provider's availability and click Book without leaving their desk. The cost also accounts for staff training and outreach to those community providers to make sure they actually use the portal on their end. It's an integration project, not a creation project.
There's a bit of a hidden catch in the CBO report, though. While the implementation costs $3 million, there is a tiny provision regarding pension adjustments that actually offsets some of that. It's one of those classic legislative maneuvers where a small change in how benefits are calculated for certain individuals over a very long timeline helps balance the books. It makes the bill technically fiscally responsible under House rules, even if the savings are coming from a completely different bucket than the IT spending.
The timeline is also worth looking at. The bill gives the VA exactly 1 year from the date of enactment to get this portal up and running. In government contractor time, 1 year is a sprint, and the law includes a sunset provision. The system has to operate for 7 years, and then Congress gets a full performance report to decide if it's actually reducing wait times. They are essentially putting the VA on a probationary period for this technology.
That performance report is the part that usually gets messy. The bill specifically asks for metrics on wait times and participation. But as we've seen with previous VA reforms, How you define a wait time can be incredibly controversial. Is it the time from when the veteran first asks for an appointment? Or the time from when the VA authorizes the community care? Or the time between the authorization and the actual day the veteran sits in the doctor's chair? The bill tries to pin some of that down, but the implementation will be where the real friction lives.
The report also mentions that the VA has to maintain a public website with details about the program. This seems like a direct response to the criticism that the community care program has been a black box for veterans. If you go to the record of the committee proceedings, there is a real emphasis on transparency. They want veterans to know exactly what they are entitled to and which doctors are in the network. Right now, a lot of that information is buried in PDFs or requires a phone call to a regional office.
It's a push toward a private sector consumer experience. If you use a modern healthcare app, you expect to see the doctor's rating, their location, and their next available opening. The VA is trying to replicate that, but they're doing it within the constraints of federal privacy laws and a massive legacy bureaucracy. Representative Bost noted in the committee's findings that this is about modernizing outdated systems to match private sector efficiency. That phrase gets used a lot in Washington, but here, with a $3 million price tag, it actually feels like a targeted surgical strike rather than a massive sweeping overhaul that risks collapsing under its own weight.
One detail that might get overlooked is the outreach component. The bill doesn't just tell the VA to build a portal, it tells them they have to actively recruit community providers to participate in it. If the private doctors don't sign on to use the portal, the whole thing falls apart. You'd still have a VA staffer staring at a screen while a private clinic is still waiting for a fax. The bill allocates part of that budget specifically for a campaign to get those private offices integrated into the new workflow.
It's a massive lift for $3 million. But if it works, it addresses that administrative loop we were talking about earlier. The goal is to move the VA from being a gatekeeper that makes things difficult to a facilitator that makes things easy. And with the bill moving to the committee of the whole House, it's clear the leadership thinks this is a win they can put on the board relatively quickly.
It's a rare instance where the advocacy from a group like the American Legion aligns perfectly with a low-cost, high-impact technological fix. Usually, when veterans groups want something, it involves multi-billion-dollar expansions of benefits. Here, they are just asking for the software to work the way it was supposed to work years ago. It's about fulfilling a promise that has already been made, rather than making a new one.
And that leads us back to the broader theme of efficiency. Sometimes the most important changes aren't the ones that cost the most, but the ones that remove the smallest, most annoying barriers. However, as we look at the rest of the calendar from yesterday, we see that while the VA is trying to close gaps in care, other parts of the federal code are dealing with gaps that were left wide open on purpose.
That is the perfect bridge to our next topic. While the House Committee on Veterans Affairs is trying to tighten up the rules for medical scheduling, there is a much larger conversation happening about who exactly is responsible when healthcare promises aren't kept in the private sector.
We're talking about the ERISA Loophole, a decades-old piece of legislation that is suddenly back in the spotlight because of how it handles employer-sponsored insurance and the liability that comes with it. The ERISA loophole is one of those phrases that sounds like it belongs in a graduate-level tax seminar, but for a huge number of parents, it translates to a very specific, very frustrating financial headache. Since we have a bit more room to look at the mechanics here, I want to pull back the curtain on how a law from the disco era is currently dictating who gets paid when a child goes to the pediatrician in 2026.
You are talking about the Employee Retirement Income Security Act of 1974. When Congress passed that, the goal was to protect employee pensions and provide some baseline rules for health plans offered by large companies. It was a massive undertaking, but because it was 1974, the authors were thinking almost exclusively about traditional, employer-provided group insurance. They weren't looking at the individual market or the complex web of private insurers we have today. And they certainly weren't anticipating how that would intersect with modern custody arrangements.
Exactly. The current setup creates this bizarre middleman situation. Imagine you're a divorced parent. The court has ordered your ex-spouse to provide health insurance for your child. You have primary custody, so when the kid gets a double ear infection or needs braces, you're the one taking them to the doctor. You pay the copay or the out-of-pocket costs at the front desk. Under the current federal code, if that insurance is a group plan governed by ERISA, the insurer has to send the reimbursement check directly to you, the person who actually paid the bill.
But if that plan is not an ERISA-governed group plan, say it's an individual policy from the exchange or a smaller private plan, that requirement simply doesn't exist. The insurer can, and often does, send the reimbursement check to the policyholder. That would be the non-custodial parent who didn't pay the doctor's bill in the first place.
Right. So now you, as the custodial parent, have already paid $500 for a procedure, and the insurance company sends a $500 check to your ex. Now, you have to ask them for the money. If the relationship is strained, or if that person is dealing with their own financial issues, that money might never make it to you. You are essentially being forced to chase down a private debt that the insurance company should have cleared with you directly.
Yesterday, Monday, Eleanor Holmes Norton, the Democrat from District of Columbia, introduced a bill to address this specific friction point. It's called the Insuring Child Health Coverage Compensation in Divorce Act of 2026. The text she submitted to the record is very direct about the fix. She stated, "This bill would require all health insurers to directly reimburse a custodial parent for any out-of-pocket medical expenses for a child incurred by such parent, if a court directs a non-custodial parent to provide health insurance."
What stands out to me in the record is that she specifically mentions this applies to step-parents as well. That's a detail that often gets lost. If a court orders a step-parent to provide that coverage, the same reimbursement rules would apply. It's trying to catch the law up to the reality of 2026 family structures, where the primary policyholder isn't always the person sitting in the waiting room at the hospital.
The research on this suggests the gap persists because of how ERISA preempts state law. Usually, if the federal government hasn't regulated something, states can step in. But ERISA is notoriously protective of its own jurisdiction. It creates a deemer clause that prevents states from regulating employee benefit plans in certain ways. Because the 1974 law only mandated direct reimbursement for group plans, non-group plans fell into this regulatory vacuum where neither the federal government nor, in many cases, state insurance commissioners felt they had the clear authority to mandate direct payment to the non-policyholder.
I can hear the counter-argument from the insurance lobby already. They will say this creates an administrative nightmare. They have a contract with the policyholder. They have the policyholder's address on file and their banking information for direct deposits. From their perspective, the person who pays the premiums is the person they deal with. They might argue that verifying who is a custodial parent for every claim adds a layer of bureaucracy that will drive up premiums.
That argument loses some steam when you look at how group plans already handle this. Since 1974, large employer plans have been using something called a Qualified Medical Child Support Order, or a QMCSO. It's a legal document that tells the insurance company, this person is the custodial parent. Send them the checks. If the biggest insurers in the country have been doing this for 50 years for IBM or Ford employees, the technical infrastructure to identify the correct recipient is already there. Norton is basically saying there is no reason a smaller private insurer can't use that same process.
It's a question of who bears the burden of the paperwork. Right now, the burden is entirely on the parent who is likely already stretched thin. If you look at the 2026 economic context, with healthcare costs rising and the general cost of living being what it is, a $300 reimbursement check isn't just a rounding error for most families. It's the difference between paying the utility bill or not. Forcing a parent to engage in a legal or personal battle with an ex-spouse for that money is a significant hurdle.
And the transcript shows that Norton is positioning this as a common-sense measure. She isn't asking for new subsidies or a government-run program. She is asking for a change in how existing insurance coverage is utilized. The money is already being paid out by the insurer. This bill just changes the destination of the check to ensure it goes to the person who actually incurred the expense.
I find it interesting that this is coming up now, alongside other bills we've seen recently, like the Empowering Parents Healthcare Choices Act. There seems to be a broader movement on the Hill to look at the pipes of the healthcare system, not just the big questions of coverage, but the actual mechanics of how money and information move between providers, insurers, and patients.
Norton has a long history with this type of constituent-driven legislation. Often these bills come from a single person in the District of Columbia calling her office and saying, "My ex has the insurance. I paid the bill. The insurance company sent him the check, and he spent it." When you hear that story enough times, you realize it's not just an isolated incident. It's a flaw in the federal code.
It also speaks to the post-pandemic reality, where we have more people on individual plans than ever before. With the gig economy expanding and the way the exchange plans have evolved, the percentage of children covered by non-ERISA plans has grown significantly since the 1970s. The loophole is getting bigger because the market is shifting away from the traditional 1974 model of one person staying at one big company for 30 years.
The bill was introduced yesterday, Monday, and referred to the House Committee on Energy and Commerce, and additionally to the Committee on Ways and Means. It's a long road for a bill like this, but because it doesn't have a massive price tag for the taxpayer, it often finds its way into larger bipartisan healthcare packages. It's a matter of administrative fairness that both sides of the aisle usually find hard to argue against.
While we're on the subject of rules that govern our personal lives, there is another piece of the record from yesterday, Monday, that caught my eye. It involves a very different kind of oversight, one that moves from the doctor's office to the kitchen table.
That leads us right into what some are calling legislation from the living room. We are wrapping up this extended look at the record with a story that takes us to Central Florida. Usually, when people talk about Osceola County, the conversation revolves around the hospitality industry or the spillover from the major theme parks in Orlando. But yesterday, Monday, Representative Darren Soto, a Democrat from Florida, rose to highlight a completely different kind of landscape unfolding there.
Neo City sounds like something out of a science fiction novel, doesn't it? But the record shows it represents a massive bet on domestic manufacturing. Representative Soto spent a good portion of his time yesterday, Monday, honoring Amanda Clavijo, who serves as the Assistant County Manager for Osceola. If you follow the money and the infrastructure, Clavijo stands at the center of what some folks are starting to call the Silicon Swamp.
The phrase, Silicon Swamp, definitely has a ring to it, though Clavijo probably wouldn't use it herself. Soto specifically mentioned her humility in the record. What stands out in this tribute is the career arc. She didn't start at the top of an economic development board. She began her career in Osceola County, working in the Special Assessments Department. That is about as granular as local government gets, dealing with specific property taxes for things like streetlights or sewage.
That is the ultimate proving ground. You learn how the machinery of a county actually functions when you start in assessments. According to the transcript, Clavijo moved up to become the Office of Management and Budget Director, and then the Comptroller. Soto pointed out that she held those roles during the years following the Great Recession. That was a period when local governments across Florida were facing some of the most severe fiscal constraints in decades.
Right, and that context makes the investments she helped shepherd even more striking. Soto noted that during those lean years, her steady leadership and fiscal discipline helped guide the county toward making early investments in something called the Center for Neovation. At the time, committing public funds to a high-tech research facility probably looked like a huge risk when most counties were just trying to keep the libraries open.
It was a pivot from the traditional Florida economic model. For a long time, the strategy was build houses and attract tourists. But the Center for Neovation became the cornerstone for Neo City. If you look at the scale today, it has evolved into a 500-acre technology district. They are focusing on semiconductors and advanced manufacturing. We talk about the CHIPS Act a lot on this show at the federal level. But the Neo City project shows how that policy actually hits the ground in a local community.
The record mentions a specific number that really gives you a sense of the scale here. As assistant county manager, Clavijo is managing the implementation of state and federal grants and contracts totaling over $500 million. That is $500 million flowing into a single county's tech hub. Managing that kind of cash requires a level of administrative expertise that often goes unnoticed until something goes wrong. Soto is making sure she gets the credit while things are going right.
Managing $500 million in grants isn't just about balancing a checkbook. It involves navigating the specific requirements of the Department of Commerce, the state's economic development agencies, and private partnerships. Soto mentioned that her work is key to bringing high-wage jobs to the region. This gets to a core tension in Florida's economy, the gap between service sector wages and the cost of living. Neo City looks like an attempt to build a bridge over that gap.
And the transcript doesn't shy away from the personal side of this leadership. Soto noted that Clavijo was raised in South Florida by a single mother. He used that detail to frame her as an embodiment of the promise of public education and opportunity. It provides a glimpse into the motivation behind the work. When you see a public official pushing for long-term economic prosperity, it often stems from that first-hand understanding of how fragile financial security can be.
There's a specific quote from Representative Soto that I think captures the dual nature of her role. He said she is known for being at every field trip, game, and milestone for her two children, Jack and Sophia, while simultaneously leading this transformative work at Neo City. It's a reminder that the people designing our national semiconductor strategy aren't just names on a flowchart. They are parents and neighbors who are trying to build a future for their own kids in their own backyard.
It also highlights the shift in what we consider infrastructure. 30 years ago, a county manager in Florida was primarily worried about roads and drainage. Now, they are worried about clean rooms, circuit design, and supply chain security. Clavijo oversees multiple departments, but the semiconductor hub is clearly the jewel in the crown. The record describes it as an internationally recognized hub. That is a bold claim for a county-led initiative, but the grant money seems to back it up.
The international aspect is interesting because it connects Osceola County to global geopolitical competition. We are seeing these clusters pop up in places like Ohio and Arizona. But the Florida model at Neo City is unique because of how much the local county government is driving the bus. Usually, you see the state or the federal government take the lead. Here, Soto is crediting the Osceola Board of County Commissioners and administrators like Clavijo for having the original bold vision before the national conversation caught up to them.
Soto's tribute was part of a larger series for Women's History Month, but it feels particularly relevant because it bridges the gap between the administrative and the aspirational. He said she aspires to be a role model for women and actively supports their growth and success. In a field like advanced manufacturing and high-level municipal finance, which have historically been dominated by men, that kind of intentionality matters.
It really does. And looking at the trajectory from special assessments to assistant county manager provides a roadmap for what public service can look like. It isn't always about the person at the podium giving the speech. Sometimes the most significant impact comes from the person who understands the budget well enough to find the money for a research center that won't pay off for 10 years. That requires a very specific kind of patience.
Representative Soto closed his remarks by saying that through her leadership, dedication, and an unwavering commitment to service, she continues to make a lasting difference for Osceola County. It's a high-level recognition for someone who clearly prefers to work behind the scenes. It serves as a reminder that the big federal goals we talk about, like bringing chip manufacturing back to the U.S., depend entirely on people like Amanda Clavijo being able to execute the plan on the ground.
It's a great example of how the Congressional Record serves as a repository for these local stories that actually have national implications. If you just read the headlines about semiconductor shortages, you miss the story of the budget director in Florida who helped build a clean room in the middle of what used to be ranch land.
That brings us to the end of our deep dive into yesterday's record. From the high-stakes negotiations over the national debt to the local leaders building the next generation of American industry, the floor was busy on Monday. We appreciate you taking the extra time with us today to look past the sound bites.
There is always more to find if you're willing to read between the lines. We'll be back tomorrow to see what today's session brings. Until then, thanks for listening to this extended edition of Floor Notes.
We'll talk to you then.
You know, we can't let you go without mentioning one last bit of procedural drama from Monday's session that is going to define the next few days in the chamber.
You're looking at that discharge petition regarding the Haiti security package, aren't you? I noticed that late entry in the record as well.
Exactly. The transcript shows that the final 218th signature was officially certified yesterday. That is the magic number, and it just started a very loud 7-day ticking clock for the House leadership.
It's a bold move. It means that next week, Speaker Johnson is going to be forced to bring a bill to the floor that he's been keeping in committee for months. It's a piece of legislation he likely never wanted to see the light of day. But the House rules are the rules.
It really is the ultimate break glass in case of emergency tool for rank-and-file members. It proves that despite the party hierarchy, 218 signatures are ultimately more powerful than the Speaker's gavel. We're about to see the floor function in a way it hasn't in quite some time.
It's going to be an intense week of whipping votes to see if that bipartisan coalition actually holds when the cameras are on. But for now, that's Floor Notes Extended for today.
We appreciate you diving into the fine print with us. Stay curious, keep an eye on those tallies, and we'll talk to you again soon.